What is diabetes? Diabetes is a chronic condition that affects how your body regulates sugar, glucose, in the blood. There are several types of diabetes, with the two most common being type 1 diabetes and type 2 diabetes. 1. Type 1 diabetes. In this form of the disease, the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This means that people with type 1 diabetes cannot produce insulin, the hormone that regulates blood glucose. Therefore, they need injectable insulin to survive. 2. Type 2 diabetes. Type 2 diabetes is more common and typically occurs in adults, although it can also affect children and adolescents. In this type, the body does not use insulin effectively, a condition known as insulin resistance. Over time, the pancreas cannot produce enough insulin to maintain normal blood glucose levels. Dangers of diabetes. Uncontrolled or poorly managed diabetes can lead to a range of serious complications, including 1. Cardiovascular diseases. People with diabetes have an increased risk of heart diseases such as heart attacks and strokes. 2. Kidney disease. Diabetes can damage the kidneys, leading to kidney failure. 3. Eye problems. Diabetic retinopathy is a complication that affects the eyes and can lead to blindness. 4. Neuropathy. Nerve damage caused by diabetes can result in pain, tingling, and even loss of sensation in certain parts of the body. 5. Circulation problems. Diabetes can affect blood circulation, increasing the risk of wounds and infections that can lead to amputation. Reversing type 2 diabetes. Reversing type 2 diabetes means restoring the body's ability to effectively control blood glucose levels, often through lifestyle changes. Here are the key approaches to achieve this. 1. Diet. Diet plays a crucial role in managing type 2 diabetes, and the choice of foods you consume can directly impact your blood glucose levels. The dietary approach to reversing type 2 diabetes involves reducing simple carbohydrates and refined sugars. Simple carbohydrates and refined sugars are quickly absorbed by the body and cause spikes in blood glucose levels. Avoid foods like sweets, sodas, cakes, and white bread. Emphasis on high-fiber foods. Fiber-rich foods like vegetables, fruits, legumes, and whole grains help maintain stable glucose levels by slowing sugar absorption. Lean proteins and healthy fats. Include lean proteins such as fish, skinless chicken, lean meats, eggs, and tofu in your meals. Additionally, opt for healthy fats found in avocados, nuts, seeds, and olive oil. Portion control. Monitoring portion sizes is important to avoid excess calories and carbohydrates. Use appropriate measurements and practice portion control to keep caloric intake in check. Regular meals. Maintaining a regular meal schedule can help prevent spikes and drops in blood glucose levels. Avoid skipping meals and consider smaller, more frequent meals if necessary. Carbohydrate counting. Learning to count carbohydrates can help control carbohydrate intake and manage blood glucose levels. Your healthcare professional or a dietitian can assist with this. 2. Exercise. Regular physical activity is essential for improving insulin sensitivity and controlling type 2 diabetes. Here are the details on how to incorporate exercise into your life. Aerobic activities. Aerobic exercise, such as walking, running, swimming, cycling, and dancing, helps burn calories and improve the body's ability to use glucose for energy. Aim for at least 150 minutes of exercise per week as recommended. Strength training. Strength training using free weights, weight machines, or your body weight helps build muscle. Healthy muscles can use glucose more efficiently. 2 to 3 strength training sessions per week are beneficial. Flexibility and balance exercises. Activities like yoga and tai chi can improve flexibility, balance, and coordination, which are important for injury prevention and maintaining an active lifestyle. Consistency. Establish a realistic and sustainable exercise plan that you can maintain long-term. Consistency is key to reaping the benefits of exercise. 3. Weight loss. Weight loss is often an essential part of type 2 diabetes reversal, especially if you are overweight or obese. Here are the details on how to achieve effective weight loss. Realistic goal setting. Set realistic and long-term weight loss goals. A weight loss of 5 to 10% of your initial body weight can lead to significant improvements in blood glucose levels. Calories consumed versus calories burned. Weight loss occurs when you burn more calories than you consume. This can be achieved through a combination of diet and exercise. Professional support. Consider working with a nutritionist or personal trainer to create a personalized diet and exercise plan. Regular monitoring. Track your weight loss progress and make adjustments as needed. Sustainable changes. Focus on making lifestyle changes that you can maintain long-term rather than resorting to unsustainable fad diets. For monitoring and medication, regular monitoring of blood glucose levels and, in some cases, the use of medication are important components of managing type 2 diabetes. Self-monitoring. Learn how to use a blood glucose meter to monitor your glucose levels. Your doctor can guide you on when and how often to take these measurements. Medication. Your doctor may prescribe medications to help control blood glucose levels. Some medications increase insulin sensitivity, while others reduce glucose production by the liver. Insulin. In some cases, insulin may be necessary to control type 2 diabetes. It can be administered through injections or an insulin pump. Medical guidance. It's important to strictly follow your doctor's instructions regarding medication use and make adjustments as needed. 5. Stress management and adequate sleep. Chronic stress and lack of sleep can negatively affect control. Here are details on how to address these aspects. Stress management techniques. Practicing relaxation techniques such as meditation, mindfulness, yoga, or Tai Chi can help reduce stress. Breathing exercises. Learn deep breathing techniques and practice them regularly to reduce stress levels. Adequate sleep. Ensure you get 7 to 9 hours of quality sleep per night. Establish a consistent routine and avoid stimulants before bedtime. 6. Medical support. Working closely with a healthcare professional, such as an endocrinologist, is crucial for creating and monitoring a personalized plan. Your doctor can assess your condition, perform blood tests, and assess your blood glucose levels to determine the status of diabetes. Prescribe medications. If necessary, your doctor can prescribe specific medications and adjust them based on your progress. Provide education. Guide you on diabetes, your diet, exercise, and proper monitoring. Track your progress. Conduct regular assessments to track your progress and make adjustments to the treatment plan as needed. Remember that complete reversal of type 2 diabetes may not be possible for everyone, and the primary goal should be adequate disease control to prevent complications. Continuous follow-up with a healthcare professional is essential for long-term success. Additionally, information and approaches may vary from person to person, so it's crucial to follow your doctor's guidance.